Lesson 3. The 11 weak points with the mirror technique. We have to think about the movement of the mirror view technique. The 11 weak points with the mirror technique. Number 1. The mirror's view is opposite from the direct view. Microdental research. I will demonstrate the treatment of the upper front teeth's palate side using the surgical microscope with the microendoscopic technique and the maxillary mirror technique's mirror movement. I call this the maxillary mirror technique. In this illustration, I'm treating the upper front teeth's palate side with the 12 o'clock position. This technique requires a relationship between the 12 o'clock position, the mirror, and the treatment area. Direct view right side, left side, upper, lower. Maxillary mirror technique is the same. Right, same side, left, same side, upper, same side, lower, same side, but so near side and far side is opposite. This is a direct view. This is a maxillary mirror technique. Near side, far side is opposite. Maxillary mirror technique, left, right, upper, lower side is the same. But the maxillary mirror technique's near and the far side movement is opposite. Microdental research. I will demonstrate the treatment of a lower front teeth ringer side using the surgical microscope with the microendoscopic technique. This is a direct view, and the mandibular mirror technique's mirror movement. I call this the mandibular mirror technique. In this illustration, I'm treating the lower front teeth ringer side with the 12 o'clock position. This technique requires a relationship between the 12 o'clock position, the mirror, and the treatment area. So this is a direct view, right and left and upper and lower. This is the mandibular mirror technique. Right and left is the same, but upper and lower is opposite. This is a direct view, far side and near side. Mandibular mirror technique is the far side, near side is opposite. Mandibular mirror technique, left and right is the same, but the mandibular mirror techniques near and far side and upper and lower side movements are opposite. The 11 weak points with the mirror technique. Number 2. The operator has to perform one-handed treatment. The 11 weak points with the mirror technique. Number 3. The dental assistant has to perform one-handed assistance. The surgical microscope's conventional technique uses the mirror technique. If we use the mirror, this allows us to only use one hand during treatment. This is due to the fact that we have to use one hand for the mirror and the other hand for treatment. One hand to treat. As for the assistant, they must direct the air syringe towards the mirror with one hand in order to avoid the mirror from becoming cloudy. As for the other hand, they must use it to assist the dentist. One hand assist. The mirror technique, 2 people, 2 hands. The microendoscopic technique, 2 people, 4 hands. Microdental research, comparing a one-handed incision with that of a two-handed incision while using a 15C blade. This is a direct view. This is a one-hand incision. Very difficult. Control the blade. So sometimes slip, sometimes stuck. This is one-hand treatment. This is both hands incision. I can control 15C blade. As you can see, this is both hands treatment. Result 108 mistakes, both hands 1 mistake. The microendoscopic technique reduces mistakes by 8 times. This is the result. The microendoscopic technique allows us to use both hands during treatment. The microendoscopic technique reduces the treatment time and increases the quality of treatment. When conducting surgical treatment, we must use both hands in order to avoid making any mistakes during treatment. The 11-week points with the mirror technique. Number 4. The mirror continuously moves during treatment, therefore making it difficult to adjust the focus. If we use the mirror technique during treatment, it becomes very difficult to focus on the treatment area. These elements are the risk factor for achieving an accurate focus, so mirror is don't fix. These elements are the risk factor for achieving an accurate focus. The microscopic technique again method is very good for accurate focus. This is a microendoscopic technique again method. The microendoscopic technique again method is very good for achieving an accurate focus. This is a mirror technique. In a magnified situation, there is an extreme amount of vibration because it is difficult to hold the mirror without movement even when in a fixed resting position. The mirror technique is very bad for our eyes. Let's watch a clip of the mirror's movement while the hand is in a resting position. This is a mirror's movement, vibrates a lot, so the mirror's movement while the hand is in a resting position. So very difficult, accurate focus, as you can see. This is a microscopic technique again method. So left side is a microscopic technique again method. Right side is a mirror technique. The mirror's movement while the hand is in a resting position. Here, vibrates a lot. The 11 weak points with the mirror technique number 5. The mirror technique's field of view is limited by the mirror's width. Therefore, field of view is very small. The mirror technique's field of view is limited by the mirror's diameter. Therefore, the mirror technique's field of view is very small and limited. This is my research. I will review Carl Zeiss surgical microscope's field of view. So color this, and this is my review. So almost same. This is a 3.4 magnified field of view, and compare the mirror's field of view, very small. The dental mirror's field of view is restricted to about 2.5 centimeter or more small. The 11 weak points with the mirror technique number 6. In theory, the mirror technique can achieve the 3D view, though normally it feels difficult to see the 3D view with the mirror technique. What is 3D? Binoculars allows us to recognize the 3D view. In theory, we can achieve binocular view with the mirror, though in actually, it is extremely difficult to recognize the 3D view. The direct view with the surgical microscope can achieve the 3D view. In theory, we can achieve binocular view with the mirror, though in actually, it is extremely difficult to recognize the 3D view. Why is it so difficult to see the 3D view with the mirror technique? I have two theories. The mirror technique's field of view is limited by the mirror's 2.5 diameter. Therefore, it is difficult to see the 3D view with the mirror technique. Next, we can't keep a fixed posture during treatment. In theory, we can achieve binocular view with the mirror, but normally the mirror vibrates during treatment. Therefore, it is difficult to see 3D view, direct view versus mirror view, passing the thread through the needle hole. This is a direct view. The direct view can achieve the binocular view. In theory, we can achieve binocular view with the mirror, but normally the mirror vibrates during treatment, therefore it is very difficult to see the 3D view. This is a mirror view. Left side is direct view. So left side is direct view. Direct view versus mirror view, attempting to pass the thread through the needle hole within 30 seconds. This is a direct view. So, the direct view can achieve the binocular view. Of course, direct view, we can use both hands during treatment. Easy to pass the thread. In theory, we can achieve binocular view with the mirror, but normally the mirror vibrates during the treatment, therefore it is very difficult to see the 3D view. And mirror technique is one-hand treatment, very difficult to pass the thread. So left side is direct view. Please watch. So comparing direct view and mirror technique. The 11 weak points with mirror technique number 7. It is very difficult to treat multiple teeth with the mirror technique. Direct view versus mirror view. While using the direct view, I am attempting to pass the thread through the 4-needle hole. The microscopic technique normally uses the direct view. The direct view can achieve the binocular view and a wide field of view. So, I could easily complete passing the thread through the needle hole. The mirror technique uses a 2.5 cm mirror, so the field of view is restricted by the width of the mirror. It is hard to achieve the binocular view with the mirror technique. Therefore, it is very difficult to complete passing the fourth thread through the needle holes within 30 seconds. So I can pass the thread, but I miss the needle hole. This is a wrong hole. Here, this is the next. The mirror technique has weak points and it makes it difficult to treat multiple teeth. Therefore, the 12 o'clock portion, which is the surgical microscope's conventional technique, is good for endodontic treatment and or easy to access places within the mouth, though it is not ideal for periodontal treatment. Direct view with surgical microscope can achieve 3D view. The mirror technique's field of view is limited by the mirror's diameter. Therefore, it is difficult to see the 3D view with the mirror technique. The 11 weak points with the mirror technique number 8. When we perform root debridement with the conventional technique, the operator needs 3 hands. This is the 12 o'clock position for conventional technique. This is the 12 o'clock position for the conventional technique. I am attempting to perform debridement on the premolar tooth. When attempting to perform debridement, we need 3 hands. First, mirror. Second, retracted soft tissue. Third hand, we need ultrasonic scale. This is a 12 o'clock position for conventional technique. I am attempting to perform debridement on the premolar tooth. So same. First, we need a first mirror. Second, retracted soft tissue. Third, ultrasonic scale. We need 3 hands. The 11 weak points with the mirror technique number 9. When performing root debridement on deep pockets while using the conventional technique, the operator will need 4 hands. First, mirror. Second, retract soft tissue. Third, micromirror. Fourth, ultrasonic scale. The 11 weak points, the mirror technique number 10. If a dental hygienist wants to perform maintenance with using the conventional technique, the dental hygienist will need 6 hands. First, mirror. Second hand, ultrasonic scale. Third hand, air syringe. Fourth hand, vacuum. Fifth hand, retractor. Sixth hand, micromirror. The 11 weak points with the mirror technique number 11. If a dental hygienist performs maintenance by use of the conventional technique, the risk for malpractice will increase. So same, if a dental hygienist performs maintenance by use of the conventional technique, the risk for malpractice will increase. The micro dental research. This is a conventional technique 12 o'clock position. This is a conventional technique 12 o'clock position. This script so easy to understand. If some problem happen, very difficult recovery because conventional technique has obstacle between the operator and the patient and limited the field of view by mirror, the width. Very narrow field of view. This is a microscopic technique CAM method. Easy to find. The 12 o'clock position conventional technique has many weak points. Number 1, the mirror's view is opposite from the direct view. Number 2, the operator has to perform one-handed treatment. Number 3, the dental assistant has to perform one-handed assistance. Number 4, mirror continuously moves during treatment, therefore making it difficult to adjust the focus. Number 5, mirror technique's field of view is limited by the mirror's width. Therefore, field of view is very small. Number 6. In theory, the mirror technique can achieve the 3D view, though normally it feels difficult to see the 3D view with the mirror technique. Number 7. It is very difficult to treat multiple teeth with the mirror technique. Number 8. When we perform root debridement with the conventional technique, the operator needs 3 hands. When performing root debridement on deep pockets, while using the conventional technique, the operator will need 4 hands. Number 10. If a dental hygienist wants to perform maintenance with using the conventional technique, the dental hygienist will need 6 hands. If a dental hygienist performs maintenance by use of the conventional technique, the risk for malpractice will increase. Without a doubt, we need a mirror technique. Some place we have to use a mirror, but we have to know the mirror technique's handicaps. Why do we mainly use the mirror technique? So posture. The microscopic technique is good posture, as you can see. The 12 o'clock conventional technique has many weak points. Therefore, periodontists don't use a surgical microscope for periodontal disease treatment. The conventional technique proves to be good for endodontic treatment but very difficult for periodontal treatment. On the other hand, the microscopic technique is good for every dental treatment. This is my innovation. The 12 o'clock conventional technique has many weak points. Therefore, periodontists normally don't use the surgical microscope for periodontal disease treatment. I will show you a clip on how difficult it is to perform an incision while using a 15C blade, of course one hand. Here you see a 15C blade on one-handed incision with the use of the mirror technique. So, I will perform incision left upper, so pictures shape, but very difficult to recognize this shape because very narrow field of view. So this dentist's mirror technique skill is excellent, as you can see, but very narrow field of view, very difficult to focus, and one hand incision, very dangerous, I thought. The 12 o'clock conventional technique has many weak points. Therefore, periodontists don't use the surgical microscope for periodontal disease treatment. The conventional technique proves to be good for endodontic treatment but very difficult for periodontal treatment. On the other hand, the microscopic technique is good for every dental treatment. So this is my innovation. weak points of the 12 o'clock conventional technique. It is very difficult to use surgical microscope in our daily practice. The question for the ophthalmologist. Question 1. I believe that in the medical treatment, we have to observe the affected place directly. In dental field, we use the mirror technique for treatment. Do you think for mirror view treatment? Answer 1. I studied medical field for a long time, but I don't know the mirror technique. I think the mirror view treatment is too risky. We have to observe the affected place directly for safety treatment. So question 2. In ophthalmology, do they use mirror view technique for surgery? Answer 2. We never ever use mirror view for surgery. In ophthalmology surgery, every time there is risk for loss of patient eyesight. Therefore, the mirror view treatment is too risky in medical field. We never use mirror view treatment.